Hello, I'm Dr. Tim Shaver from Arthritis and Rheumatology Clinics of Kansas. Today I'm going to visit with you about gout. Gout is now the most common form of inflammatory arthritis in the United States. It's eclipsed rheumatoid arthritis. It is going to affect about 4% of the overall population. It's about 3 times as common in men as it is in women. One thing that's pretty unique about gout is we know exactly what causes it. Most diseases we see here, people ask us what causes them. We really don't have a clear idea of that. Gout, we know exactly what causes it. The uric acid level becomes elevated, and at a certain level, crystals form that get into the joint and cause acute flares of inflammation. This is most common in the cooler parts of the body, such as in the foot or ankle, but it can occur in other joints as well. When we look at gout, this is a very treatable disease because we know exactly what causes it and we have specific therapies that address that problem very precisely. So this is something we feel like we can treat, and that's our goal, is to get this under very good control. Now, there are a few myths I'd like to bust about gout. First thing is, many people feel like you can make the diagnosis of gout on the basis of a simple blood test. And that's not true. Actually, a uric acid level is going to be elevated in most people with gout, but it's true that neither does a uric acid level being elevated always mean you have gout, nor does a normal or relatively normal uric acid level rule out gout. You can see a uric acid level drop during an acute flare, and that could be misleading. The only clear way to make a diagnosis is to obtain fluid out of the joint that's been impacted by that disease. Now, that can be a painful procedure, but at the same time, most people we do this to tell us that it's not as painful as the flares themselves. The flares themselves are very debilitating, and for that reason, we have a high priority to get the diagnosis correctly, plus to rule out infection in that joint. Now, if you don't have the opportunity to get fluid, you can make the diagnosis on the basis of the fact that we see more acute flares that tend to come and go. They seem to be in certain areas. They are usually associated with redness, and they come intermittently like this. So if we don't have the opportunity to get the fluid, we can sometimes make the diagnosis on that basis, plus the lab and maybe some imaging studies. But at the same time, the ideal way is to get the fluid out of the joint. Second misconception is during the acute flare that we have to get the uric acid level down. And actually, the uric acid level being elevated is why the flare happened, but if we talk about what we need to do during the flare, we need to treat the inflammation. It's kind of like when you have a kidney stone. The reason you have the kidney stones, you're putting out too much calcium in the urine. You don't just say, I'm going to have you put out less calcium in your urine and that's going to treat the kidney stone. We need to treat the symptoms of that kidney stone. So we treat the inflammation with the acute gout flare, and we try to do that with certain medications like anti-inflammatory drugs, a drug called colchicine, or at times steroids, either in the joint itself or orally, or even sometimes by shot or intramuscular. The third misconception about gout is that you can place someone on a standard dose of medication and let them ride and not ever have to worry about that again. Really what we need to do is we need to achieve our goal. We need to treat to target when we're treating gout. So there's several medications that will lower your uric acid level, and when we lower the uric acid level, what we try to do is get you under 6.0 milligram per deciliter on the lab studies we're doing. And that might take a low dose for some people, it might take a higher dose. The medications we use are drugs like allopurinol, a new drug known as Uloric that we can use, one called probenecid, and then several others we have that are available that we can use either alone or in combination. And with the right combination of drugs, we can typically get that uric acid level where we want it. Now, while we're doing that, and the reason we don't do just the uric acid lowering drugs during the flare is because when you're mobilizing those crystals, it can stir things up and it can cause actually more inflammation to happen. So we're trying to treat the inflammation as we're doing this, as we're flushing that out of the body. But if we do this for a long enough period of time, usually about 6 months or so, we can typically get this under control. So that is our goal. Now, I will tell you that gout is common enough that often this is going to be managed by a primary care physician, and that's fine. But if patients have difficult enough to treat gout, we would love to be the ones to see them and to get them under control, because it's our priority to do that. This is a very painful and debilitating disease, but it is very treatable. So hopefully you'll find the need to entrust yourselves to a capable practitioner, and we would be glad to be involved in your care. And appreciate you listening. Thanks.